I think we're about to approach the time, at least in the next 5 to 10 years, that the feared drill will be past tense. With the advent of lasers, and once upon a time those lasers were as big as the early computers, but today they're small and they're absolutely painless. And I think that will probably replace that terrible, terrible drill that everyone seems to be afraid of. There's so many procedures in dentistry that everyone's worried about. Root canal therapy today, believe it or not, is not uncomfortable. And what it amounts to is you've known about fillings in teeth for a long time. That just fills the teeth, the part of the teeth that you can see in your mouth. Well, a root canal just fills the tooth all the way to the end of the root. It's nothing more or nothing less than that. The tooth is prepared just like it would if you were putting a filling in it, except the 1 or 2 or 3 canals, and those are the nerve channels that go right down the roots, are cleaned out and sealed all the way to the end. And that's all it is to that magic thing called a root canal. I wish we could think of another name for it, but it's gotten a bad name. But you don't need to lay awake at night worrying about a root canal. The beautiful thing about a root canal filling is it keeps your tooth. We do lots and lots of cosmetic restorations today because that's the thing to do in this time in our life. So the front teeth many times are called caps or crowns, and all that means is we just cover them up completely with a base of metal, and over that metal is some sort of a pretty material that makes it look like you have a beautiful smile, and that's what we want. The technology today for making crowns and bridges is just unbelievable, and it's getting to the point where we're not even going to have to use metal before long. It can be all tooth-colored material, even in long span bridges. For instance, go from a lower eye tooth all the way back to the second molar. It'll be in your lifetime, that'll be available. It hasn't been in mine, but it's exciting to see something like that. Geriatric dentistry, that big word that folks my age don't like to be called, but we have to admit to it sometimes, is really one of the newest things and newest opportunities in dentistry today. We're all living longer, we're working longer, we're staying healthy longer because of those great things that have happened to us in our lifetime, the wonderful advantages that we have over the past generation. So it's nice now to be able to treat folks who are seniors, and to treat them well and to make sure that they have those teeth and have that smile until the day they leave this earth. And we want you and all your friends to come and visit us at Oklahoma Dentistry and any of our offices, and we're going to treat you like you're visiting company. Smiles are things that are very important, and we know that, and we want you to keep smiling, not only when you come in, but when you leave.